Good afternoon, everyone, and welcome to the June 11th, 2025 Legislation and Regulation Committee meeting. My name is Jessie Crowley, Chairperson of the committee. Before we convene, I would like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. As I facilitate this meeting, I will announce when we are accepting public comment. I've advised the meeting moderator to allot 3 minutes to each individual providing comments. We will begin with public comment for individuals attending in person, followed by public comments by individuals via WebEx. This approach is necessary to facilitate the meeting. Before we get started, I'd like to ask staff moderating the meeting to provide general instructions on the process for providing public comment via WebEx.
Thank you. This is the moderator. And if anyone has a comment during a public comment period, you can look for the hand icon. That's typically at the bottom of your WebEx screen if you're logged in on a computer. If you're on a mobile device, the hand raise might be behind the three dot other options. And if you're a call-in user, the hand raise will be done by pressing *3. And we will display a slide at each public comment period. As mentioned, you'll have 3 minutes with a 10-second warning, and we ask people to speak only once per agenda item. We will defer to public comments in the room first and then by WebEx if we do have any public attendees. Thank you.
Perfect, thank you. I'd like to now take a roll call to establish a quorum. Trevor Chandler.
Present.
Thank you. KK Jha.
Present.
Thank you. Maria Serpa.
Aye, licensee member present.
Thank you. Nicole Tebow.
Licensee member present.
Thank you. And Jessie Crowley, I'm present. A quorum has been established. Members, we have a full agenda for our meeting today. I ask everyone participating to be respectful of the work before the committee today. We encourage participation by members of the public throughout our meetings at appropriate times. The committee respectfully requests that when comments are provided, they are done so in a professional manner consistent with how the committee conducts its business. Finally, before we move to the next agenda item, I would like to remind committee members participating via WebEx to please remain visible on camera throughout the open portion of today's meeting. Members, if you need to temporarily turn off your camera due to challenges with internet connectivity, please remember to announce the reason for your non-appearance when you turn off your camera. Agenda item 2, public comment on items not on the agenda or agenda items for future meetings. I will now ask the moderator to open the line for individuals to provide opportunity to provide public comment. You are not required to identify yourself, but may do so. I would like to remind everyone that the committee cannot take action on these items except to decide whether to place an item on a future agenda. Members, following review of the public comments for this agenda item, I'll ask members to comment on what, if any, item should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, but rather an opportunity for members of the committee and members of the public to request consideration of an item for future placement on an agenda, at which time a discussion will be may occur. Before we get started, can I ask if there are any members of the public present in the Sacramento location?
There are not.
Okay, if that changes, please let me know. In the meantime, moderator, we're ready for public comment for individuals via WebEx.
Thank you. If anyone would like to make a comment on an item that is not already on the agenda or a suggestion of a future agenda item, you can look for the hand icon at the bottom of your WebEx screen. Or if you're on a mobile device, it may be behind the three dot other options. And if you are a call-in user, you can press *3 to raise your hand. Each speaker will have 3 minutes with a 10-second warning. Are there any topics not on the agenda or for future meetings? I do not see any requests for comment. Shall I close the public comment feature?
Yes, please. Thank you, Ann.
You're welcome.
Agenda item 3, approval of April 9th, 2025 committee meeting minutes. Members, as we begin our consideration, I'll ask members that if they have any questions or comments on the draft minutes from the April 9th, 2025 meeting. I will also entertain a motion if you believe such action is appropriate. Does anyone want to make a motion?
I'll make the motion. I move to approve the April 9th, 2025 Legislation and Regulation Committee meeting minutes as presented in the meeting materials.
Great, thank you, Nicole.
Second.
Thank you, Trevor. With the motion and a second on the floor, I will now open the discussion for public comment on the April 9th, 2025 draft minutes.
Thank you. This is the moderator. Of any comments or yes, we're assuming no commenters in Sacramento. If anyone would like to make a comment on the minutes, you may look for the hand icon and click that to raise your hand. Instructions are on the screen. Each speaker would have 3 minutes. Are there any comments on the meeting minutes? I do not see any requests for comment. Shall I close that feature?
Yes, please.
Thank you.
Thank you. I will now bring the discussion back to members and take a roll call vote. So if there are no additional comments, Trevor, how do you vote?
Yes.
Thank you. KK?
Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes, the motion passes. Agenda item 4, discussion and consideration of pending legislation impacting the practice of pharmacy, the board's jurisdiction, or board operations. Member, there are a number of measures included on the agenda today for our discussion. May 16th, 2025 was the last day for policy committees to meet prior to the June 9th deadline, and May 23rd was the last day for fiscal committees to hear and report to the floor for their respective house. The next legislative deadlines include July 18th as the last day for policy committees to meet prior to summer recess. The meeting agenda and materials identify pending measures impacting the practice of pharmacy, the board's jurisdiction, or board operation that were identified during the development of the agenda for this meeting. I note that a few measures previously considered by the board did not make it out of committee for this year, including Senate Bill 548, and as such is not included and will not be discussed. Members, do you have any questions or comments before we proceed? Great, seeing none. Assembly Bill 50, pharmacists furnishing contraception. This first measure for our consideration is Assembly Bill 50. Members, this measure would update provisions related to pharmacist furnished hormonal contraception to explicitly allow pharmacists to furnish over-the-counter contraception without following the standardized procedures required for prescription-only hormonal contraception. Further, the measure would allow for the furnishing of up to a 12-month supply at one time of over-the-counter contraception. This measure passed out of the Senate Business and Professions and Economic Development Committee earlier this week and was re-referred to the Appropriations Committee. The board established a support position on this measure. Members, I believe the board's current support position remains appropriate, and I welcome your comments if you have any. Great, hearing none. Moderator, I think we're ready for public comment for individuals via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment on the motion, you may look for the hand icon and click that. And our call-in users may press *3 to raise their hands. Are there any comments on the motion or the issue? I do not see any requests for comment. Shall I close that public comment feature?
Yes, please. Thank you.
You're welcome.
Members, Assembly Bill 309 would make pharmacists to furnish hypodermic needles and syringes for personal use. The Senate Health Committee will consider this measure on June 18th. I note considering this measure, and I agree with the recommendation to establish a support position. Members, I welcome your thoughts on this measure and would also entertain a motion to recommend establishing the position on this measure if you believe such action is appropriate.
I move to support AB 309.
Thank you. Do we have a second?
This is Nicole. I'll second.
Great, thank you. With a motion and a second, we are ready for public comment via WebEx.
And this is the moderator. If anyone has a comment on the motion or the issue, you may look for the hand icon and click that to raise your hand. Calling users may press *3. Instructions are on the screen. Are there any comments on the motion or the issue? I do not see any requests for comment. Shall I close that feature?
Yes, please. Thank you.
You're welcome.
Great, members, I'll now bring the discussion back. And if there are no additional comments, I'll take a roll call vote. Trevor, how do you vote?
Yes.
Thank you. KK?
Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes, the motion passes. Assembly Bill 447, Emergency Room Patient Prescriptions Dispensing Unused Portions Upon Discharge. Members, AB 447 would allow a prescriber to dispense an unused portion of a dangerous drug acquired by the hospital pharmacy to an emergency room patient under specified conditions, including dispensing the unused portion of the dangerous drug if required to continue treatment for the patient. Further, as amended, it would exempt from licensure an AUDS that is used to dispense to emergency room patients. Members, you may recall during our last meeting that we did not discuss AB 447 because amendments to the measure were not yet in print. I note that the amendments in the measure appear to provide clarification in some areas, which I believe are helpful. Members, I believe we should continue to watch this measure. This measure is moving quickly and was referred to Senate Business, Professions, and Economic Development Committee, but I welcome any comments that you have.
So I missed the last meeting. If you can let me know, was there a discussion on the labeling part of the medication and also consulting or counseling the patient upon discharge for the unused portion? Was there any discussion about those things?
I don't recall us having a conversation about counseling. We did have a conversation about labeling, and I know Maria had some perspective, so not to put you on the spot, but I'll probably hand that portion over to you. But I think that the consultation is definitely a good point that I don't recall us discussing last time.
So should it be helpful under the proposed language, the prescriber is required to ensure that the label on the drug does contain all of the information in section 4076, which is the prescription labeling requirements.
Great, thank you, Anne.
And that is a prescriber and not the hospital pharmacy or hospital pharmacist, correct?
So as I understand the measure and the policy intent, these drugs would be dispensed from the ER, which generally is not done by the hospital pharmacy.
Okay.
Yes, and I think the other part of our discussion was just about accounting for medications, especially because the pharmacy is responsible for the AUDS. So I think that was the big question mark for a lot of people. And Maria, I'm not sure if there's anything else you want to add, but I hope that helps to clarify things a little bit, KK.
Yeah, I would like to add, kind of repeat a little bit of what I said before, but I have big concern about the bypassing of a pharmacist in the labeling and documentation of a prescription being taken home by a patient. And this is something that commonly happens in hospitals now, where medications are either relabeled, like an inhaler would be sent to the pharmacy and relabeled and dispensed as a outpatient prescription for the patient to take home. Not charged again, but just have the appropriate label. Or in some situations, pharmacies have inhalers and those like pre-labeled, and all the nurse needs to write in is the patient's name and date. And it already has a pre-generated RX number, which they would document in a log what patient got that RX number and product that provides the documentation. My concern about the proposed legislation is that while it does seem to cover the labeling component, there's no talk about documentation, and it bypasses the pharmacy. The pharmacy owns and is responsible for all the medications that are in that AUDS. And so this would allow the physician to just remove certain products and hopefully label it and send it with a patient, but there'd be no documentation of the prescription, the FIG, any of those kinds of things. And the pharmacy would have be really unaware of it, which is really not a good thing. The current systems allow for pharmacists to be aware of it. One thing I do want to say is we did have a lot of discussion about what they talked about, unused portion of medication, and I really appreciate that board staff with the author to clarify that so it's really clear as to what products would be allowed, and that goes back to single patient multi-use packaging, which include like eye drops and inhalers and those kinds of things. I am concerned about the included solutions in that, and so does that mean that they can get a pint bottle of a medication without having any additional documentation about that? Lastly, I only talked a few seconds about last time was the ADDS licensure, and since then we've been talking about ADDS licensure and enforcement. So it reminded me of the main difference of having the ER ADDS license is it requires them to report to the board within 30 days if there's a medication error. This bill is asking for those devices to not be licensed, and as a result, the board would only be notified once per year a cumulative summary of the medication errors, so that's really not a timely amount. So I agree with the watch position, but I'm seriously to move quickly that we should speak up, because right now there doesn't appear to be any negative or concerning comments. There's only been positive comments from the hospitals and the ER organization.
This is the moderator. I'm not sure if it's a connection issue, but there are times when Maria's voice was not entirely clear. So just as a cautionary note to lean in perhaps.
Right. Thank you, Maria. I really appreciate that perspective. Members, if you don't have any other comments, I think we're ready for public comment for individuals via WebEx.
And this is the moderator. If anyone would like to make a comment on the bill or the position, you may look for the hand icon and click that to raise your hand. And our call-in users can press *3 to raise their hands. Each speaker will have 3 minutes with a 10-second warning. Are there any comments on the bill or the position? I do not see a request for comment. Shall I close the public comment feature?
Yes, please.
Thank you.
Great. So moving on to the next measure, Assembly Bill 529, Pharmacies Declared State of Emergency. Members, AB 529 would extend the board's authority to continue to waive provisions of pharmacy law for up to 120 days following the termination of a declared emergency. This measure passed out of Senate Business, Professions, and Economic Development Committee hearing earlier this week and was re-referred to Appropriations Committee with a consent calendar recommendation. The board established a support position on this measure. Members, I believe the board's current support position remains appropriate. I welcome any comments if you have any. Seeing none, moderator, we're ready for public comment via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment about the bill or the position, you may look for the hand icon and click that to raise your hand. Call-in users can press *3 to raise their hands. Users using a mobile device can look behind the 3-dot other options for that raise hand feature. Are there any comments on the bill or the position? I do not see any requests for comment. Shall I close the public comment?
Yes, please. Thank you.
You're welcome.
Okay, moving along. Assembly Bill 669, Substance Use Disorder Coverage. The next measure for our consideration is AB 669, which would ensure 28 days of inpatient, intensive, outpatient, or partial hospitalization for substance use disorder treatment for patients. The measure would also prohibit insurers from requiring prior authorization for FDA-approved medications used to treat addiction that are deemed medically necessary by a doctor. The provisions would become effective January 1st, 2027. This measure is pending referral to a Senate committee. The board established a support position on this measure. Members, I believe the board's current support position remains appropriate. Members, do you have any comments?
Yes, Chair. I just want to say I strongly support Assembly Member Haney's bill as we continue to address the opioid crisis. And as someone in recovery myself, I think that these programs are essential and we need to make them as easy to get into and as low cost as possible. And so just once again, strongly support this bill.
Great. Thank you so much, Trevor. Members, if there are no other comments, I think we're ready for public comment via WebEx.
This is the moderator. If anyone would like to make any comment on the bill or the position, you may look for the hand icon and click that to raise your hand. There are instructions on screen, and our call-in users can press *3 to raise a hand. Are there any comments? I do not see any requests for comment. Shall I close that public comment feature?
Yes, please. Thank you.
Thank you.
Members, AB 968 would allow a pharmacist to furnish a 12-month supply of an FDA-approved self-administered non-hormonal contraception at the patient's request. I note that this is the first time the committee is considering this measure, and I agree with recommendation of establishing a support position. This measure is scheduled to be considered during the Senate Business Professions and Economic Development Committee hearing on June 16th. I agree with the board staff comments that the provision in this measure will expand pharmacists' authority to furnish a 12-month supply of non-hormonal contraception. Under existing law, pharmacists have the authority to furnish hormonal contraception. Members, I welcome your thoughts on this measure and would also entertain a motion to recommend establishing a position on this measure if you believe such action is appropriate.
I
No
move to
comment?
I move to support AB 968.
Thank you, Trevor.
I'll second it.
Thank you, KK. With a motion and a second on the floor, if there's no other member comments, we can open it up for public comment via WebEx.
This is the moderator. If anyone would like to make a comment on the bill or the position, you may look for the hand icon and click that to raise your hand. Instructions are on the screen. Each speaker will have 3 minutes with a 10-second warning. Are there any comments on the bill or the position? I do not see any requests for comment. Shall I close that public comment feature?
Yes, please.
Thank you.
Thank you, Anne. Members, if there are no additional comments, I'll take a roll call vote. Trevor, how do you vote?
Yes.
Thank you, KK.
Yes.
Thank you, Maria.
Yes.
Thank you, Maria. Nicole?
Yes.
Thank you, and I vote yes, the motion passes.
Jesse, before you move on, I'm not sure if it's something that needs to be fixed, but I think the agenda had a typo for this item. The agenda says 958, but the materials all were 968, and everything else is correct. So I'm not sure if that typo is going to mean anything to the attorneys, but I hope not.
Thank you, Maria. Thanks for pointing that out.
We will get it corrected when we do the meeting minutes.
Perfect, thank you. Members, moving on to the next item, Assembly Bill 957 would prohibit a pharmacy from selling cigarettes or tobacco products. The policy goals of this measure appear consistent with the board's policy statement included in the meeting materials. This measure has been referred to Senate Rules Committee. The board established a support position on this measure. Members, I believe the board's current support position remains appropriate. I do not recommend any changes. Members, I welcome any comments that you have. Perfect. Hearing none, moderator, we're ready for public comment via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment on the bill or the position, you may look for the hand icon, typically at the bottom of your computer screen, or if you're on a mobile device, behind the 3-dot other options. Each speaker will have 3 minutes to speak. Are there any comments on the bill or the position? I do not see any requests for comment. Shall I close the public comment feature?
Yes, please. Thank you, Anne.
You're welcome.
Members, Assembly Bill 1460 would prohibit a prescription drug manufacturer from engaging in discriminatory practices that would impose additional conditions or otherwise interfere with a covered entity's purchase or delivery of a drug subject to federal pricing requirements under specified conditions. This measure has been referred to Senate Health Committee. I note that during prior discussions, we noted concerns were raised about changes being sought to restrict 340B programs and the negative impacts to such programs and how this measure could address some of those issues. Members noted that 340B federal programs play a vital role in providing services to underserved communities at a reduced cost. The board established a support position on this measure. Members, I welcome any comments. And Nicole, I know you provided a really good summary last time. So if you want to just give us another summary, I'm sure that would be helpful, especially for KK since he wasn't here last time.
Yeah, no problem. So I know most people don't know what 340B is. So 340B is a federal program that allows certain types of covered entities to purchase drugs at a discounted price. In order to do this, you have to put all of the money you save back into patient care activities. And this is specifically for safety net providers who are overrepresented in caring for people who are uninsured or underinsured and on Medicaid. This is really important because drug manufacturers have been limiting access to 340B price drugs, which is driving up patients for the most vulnerable patients. And it's become even more important since our last discussion because a lot of our funding is being, I guess, it's at risk at the federal level, especially with the current budget reconciliation that is set to knock a lot of people off Medicaid. Having access to these discounted drugs will become even more important. So definitely want to emphasize how important it is for us to support this bill. Thank you.
Thank you so much, Nicole. Moderator, I think we're ready for public comment via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment on the bill or the position, you may look for the hand icon and click that to raise your hand. Calling users can press *3 to raise their hands. We ask people to speak only once per agenda item, and you'll have 3 minutes. Are there any comments on the bill or the position? I do not see any requests for comment. Shall I close the public comment feature?
Yes, please. Quiet day today. Members, Assembly Bill 1503 is the board's sunset measure. As amended, the measure would extend the board's operation until January 1st, 2030. The measure encompasses several policy issues highlighted by the board in its sunset report. In addition to board-sponsored provisions, the measure includes a provision to require the board to establish and appoint a pharmacy technician advisory committee. In addition, the proposed ratio provisions in this measure exceed those recommended by the board. Specifically, the measure would authorize the pharmacist in charge to establish a ratio of up to 4 pharmacy technicians per each pharmacist. The board established a support position on this measure. Members, as this measure extends the operations of the board, I believe the board's current support position remains appropriate. I welcome your comments and just add, given the current state of affairs, I think this is really essential to move towards a standard of care model, specifically as the CDC's ACIP committee for immunization has been removed at this point. I have serious concerns about what that means for patient access to immunizations throughout the state of California. And I think that's a really important role and gives more reason why a standard of care model may be appropriate moving forward. Members, do you have any other comments? Perfect, seeing none. I think we're ready for public comment via WebEx.
This is the moderator. If anyone would like to make a comment on the bill or the position, you may look for the hand icon and click that to raise your hand. And our call-in users can press *3 to raise their hand. Are there any comments on the bill or the position? I do not see any requests for comment. Shall I close the public comment feature?
Yes, please. Thank you.
You're welcome.
Members, at Trevor's request, Senate Bill 40 has been brought to the committee. Senate Bill 40 would prohibit a healthcare service plan or health insurer from imposing step therapy as a prerequisite to authorizing coverage of insulin, and would establish a cap on the cost of a 30-day supply of insulin. This measure has been referred to Assembly Health Committee. I agree with the recommendation to establish a support position. Members, I welcome your thoughts on this measure and would also entertain a motion if you believe such action is appropriate.
Just want to say thank you for bringing this up, and I move that we support Senate Bill 40.
Thank you. And I will actually second that motion. I'm just double checking on my screen. I don't know if it happened for anyone else, but I don't see KK on my screen anymore. Did he fall off?
It does appear that his connection dropped, yes.
You know what? Maybe we'll just give him a moment since this is a new measure, just in case he wants to make any comments. So we'll just give it a minute before we open it up.
Anyone have any stand-up or karaoke we can do in the meantime?
Always, but I'll just lose my voice more.
I was gonna say you're sounding. I hope
I
you're
know,
well.
it feels like every time I have a meeting, I lose my voice. Okay, and it looks like Ann Sodergren is reaching out to KK now, so hopefully we get him back on. I will say that the one good thing about losing my voice is I can hit the low notes I normally can't. One moment.
Yeah, just a heads up to everyone that this is your first WebEx with the new one. I had to do one this morning and ran into all the same trouble. I had to update the app and I had to it didn't prompt me automatic. I had to try to sign in and kind of force it to do it to get it to work again. We were all having all this trouble in our first meeting this morning too, so.
Okay, so it looks like KK is rejoining, so he should be on in a couple minutes.
And welcome back, KK Jha. All right.
Can you see me or hear me?
Yes, we can both.
Okay, sorry. My computer froze, so I don't know what happened. My apologies.
That's okay, KK.
KK, did you hear the motion or should we restate the motion?
And I froze a lot before the last motion was talked about or through.
Okay, Trevor, would you mind restating the motion, please?
Yep. I moved to support Senate Bill 40 by Senator Wiener regarding healthcare coverage and insulin, and it was seconded by Jesse.
Yep. And then just for more background, KK, this measure would prohibit a healthcare service plan or health insurer from imposing step therapy as a prerequisite to authorizing coverage of insulin, and it would also cap insulin costs for a 30-day supply.
I can second it if needed.
Great.
This is Nicole. Great. Love this
I
concept.
believe Jesse already seconded the motion, KK.
Sorry, can you all hear me?
Yes, we can hear you, Nicole.
Okay, perfect. Great. Love the concept and everything. The only thing I want to flag, and I'll be honest, I have not read it. It might be there. Just want to make sure that there's no way that the insurance companies can then pass this cost on to the pharmacy, can overcharge the pharmacy, make us significantly lose money as a result of the limit in price. Senator Wiener's pretty good about this stuff. I would imagine something is in there, but I would definitely want us to like take a look and make that recommendation if it's not.
Thank you, Nicole. That's a really good point. Great. So if we don't have any other comments from members, Anne, I think we're ready for public comment via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment about the motion or the bill, you may look for the hand icon at the bottom of your WebEx screen. Our calling users can press *3, and each person will have 3 minutes to present their views. Are there any comments on the motion or the bill? I do not see any requests for comment. Shall I close that public comment feature?
Yes, please. Thank you.
You're welcome.
Great. Members, if there are no additional comments, I will take a roll call vote. Trevor, how do you vote?
Yes.
Thank you. KK?
Yes. Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes. Members, as amended, Senate Bill 41 would establish the regulation of pharmacy benefits managers, also known as PBMs, within the Department of Insurance. The measure has been referred to the Assembly Health and Judiciary Committee. As meeting materials note, the board has received public comments and complaints from consumers and healthcare providers stemming from actions by PBMs. This measure is similar to Senate Bill 966 from last year that was supported by the board but was vetoed by the governor. The board established a support position on this measure. Members, I believe the board's current support position remains appropriate. Members, do you have any comments? Great. Hearing none, I think we're ready for public comment via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment on the bill or the position, you may look for the hand icon and click to raise your hand, and our calling users can press *3. We do have a comment from Sean. Sean, I'll send you a request to unmute, and you'll have 3 minutes with a 10-second warning.
Hello, can you hear me?
Yes, we can.
Thank you. Thank you again, board. Thank you for the long day with the meetings from the beginning of the morning. I really appreciate Sean Kim from California Pharmacists Association as a sponsor of the bill, and we express strong support for the SB 41 Pharmacy Benefit Manager reform. While we recognize the governor's emphasis on the licensure of the PBM, we urge attention to the provisions within SB 41 that go beyond licensure alone. This bill includes urgently needed safeguards that address PBM abuses contributing to pharmacy closures. And more than just pharmacy closures, the healthcare access closures. And without reform, the PBM practices such as transparency and reimbursements and accountability for patient steering, we risk further healthcare access and compromising patient care. I don't think I need to speak the choir anymore. Everyone knows. And SB 41 really helps ensure the fair practices and support pharmacy sustainability, and even clinics and health systems, and most importantly, protecting against access to essential medications. So CPHA urges swift advancement of this legislation as a step towards restoring the balance and accountability in California's pharmacy system and the healthcare system. Thank you so much for letting me comment.
Thank you for your comments, Sean.
And I do not see any further requests for comment. Shall I close that public comment feature?
Yes, please.
Thank you.
Okay. Members, if you have no additional comments, I'll move on to the next measure. Members, Senate Bill 306 requires a covered healthcare service that has been approved 90% or more of the time in the prior calendar year to be exempt from health plan or health insurer imposed prior authorization for 1 year for in-network contracted providers. The measure has been referred to Assembly Health Committee. I note that this is the first time the committee is considering this measure, and I agree with the recommendation to establish a support position. Members, I welcome your thoughts on this measure and would also entertain a motion if you believe such action is appropriate.
I move to support SB 306.
Okay, thank you. Any second?
I can second it.
Okay, thank you.
Sorry, this is Nicole. I'm just a tiny bit confused about this one. I have what it says here. Can you just summarize one more time? So if the drug was approved for 90% of the previous year, then it can't be, can't have a prior auth the following year. Am I understanding correctly?
That's my understanding as well. And I don't know if Anne has any, and Sodagrin has any additional clarification, but that's the way that I understand it.
Yes, that's correct. If it's been 90% or more covered in the previous year, it cannot be a prior authorization the next year.
Okay, got it. I swear I read this like 5 times and I just kept getting stuck in the words and couldn't quite get to the end result. Okay, thank you, everyone.
Yes. I will just note too, we've seen obviously from the pharmacy levels, the way that patients can't continue medications that they've been on for years because of plan changes and coverages, which happens a lot, particularly with asthma and COPD medications. I will note there was headlines a few months ago when a young man with asthma wasn't able to afford his inhaler. I believe it was a generic Advair. Ended up dying as a result. And so I think this sort of measure really helps to address some of the predatory practices that can occur from the insurance ends for really life-saving medications for patients, especially when they've been on it previously. And members, if there are no other comments, I think we're ready for public comment via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment on the bill or the position, you may look for the hand icon and click that to raise your hand. Call-in users can press *3 to raise their hand. Each speaker will have 3 minutes to speak. Are there any comments on the bill or the position? I do not see any requests for comment. Shall I close public comment for this?
Yes, please.
Thank you.
Thank you. And members, if there are no additional comments, we'll take a roll call vote. Trevor, how do you vote?
Yes.
Thank you. KK?
Yes.
Thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes. The motion passes. Members, Senate Bill 470 was amended and will extend the current flexibilities provided in the Bagley-Keene Open Meetings Act to January 1st, 2030. The previous version of this measure would have made the current flexibilities permanent. The board has relied upon the current flexibilities under the temporary provisions. The measure has been referred to the Committee on Government Operations. The board established a support position on this measure, and I believe the board's current support position remains appropriate. Members, I welcome any comments that you have.
Yeah, I think this is common sense. I think our board specifically, I can't speak to all the other ones, but have demonstrated how we can effectively do this in a hybrid fashion, making sure that we're still in person and have that accountability in person, but still have the ease of access, given that, California is bigger than most countries, and getting together in person, especially for days like today and tomorrow, where we have not just regular meetings but committee meetings, this just makes sense, and I continue to support it.
Okay. Thank you, Trevor. Members, if there are no other comments. Oh, sorry, go ahead, Nicole.
Sorry, I'll jump in. Just as the disabled member of our board, this is really important to me. I can't travel, but I think I've been able to participate fully on the board because of these. So I would hope that we would be able to keep some kind of accommodation. I don't think it would be fair or appropriate to not allow people to be on a board because they have limitations or disabilities that keep them from traveling.
Yeah, I strongly support Nicole's sentiment over there. Nicole's example is there, and I'm sure there are many other people who can support in the future as well, provided, we facilitate that. So absolutely.
Absolutely, totally agree. And just want to say that, Nicole, you've been such a wonderful member of the board. You provide a wonderful perspective, and it would be a real loss to not have you here. So we're very grateful that we're able to. Very good. So I think, moderator, we're ready for public comment via WebEx.
Thank you. This is the moderator. If there are any comments on the bill or the position, you may look for the hand icon, typically at the bottom of your computer's WebEx screen, or behind the three-dot other options if you're on a mobile device, and click the hand icon to raise your hand. Are there any comments on the bill or the position? I do not see any requests for comment. Shall I close the public comment feature?
Yes, please. Thank you.
You're welcome.
Members, Senate Bill 497 would prohibit release of medical information related to a person seeking or obtaining gender-affirming healthcare or gender-affirming mental health care under specified conditions. This measure has been referred to Judiciary and Public Safety Committees. The board established a support position on this measure. Members, I believe the current board's position of support is still appropriate. Also highlighting, in light of everything else happening in this country from a federal level, I think measures like this are going to be essential to protecting Californians. Great. Members, if you have go ahead, Nicole. I saw you unmute yourself.
Yeah, I'm having trouble getting it to unmute. Sorry, I keep being delayed. Yeah, just wanted to echo what you said. Like, this is going to be crucial right now. They're going after the trans community, sometimes so broadly that they're picking other groups up in it. So having these protections is going to be really crucial as we move forward. Thank you.
Thank you, Nicole. Great. Moderator, I think we're ready for public comment via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment on the bill or the position, you may look for the hand icon at the bottom of your WebEx screen. Our call-in users can press *3 to raise their hands. Are there any comments on the bill or the position? I do not see any requests for comment. Shall I close that comment feature?
Yes, please. Thank you.
You're welcome.
Thank you. Members, SB 641 was inadvertently not included on our agenda, and unfortunately we will not be able to discuss it today, but this measure will be discussed during the board meeting later this month. Moving on to agenda item 5, regulations. Members, all items included in the regulations portion of the report are for information only. As detailed in the meeting materials and associated attachments, the board has several regulations in various stages of promulgation. I do not intend to review each as the information is contained in the public materials. The board has one regulation that was approved by the Office of Administrative Law, digital signatures. In addition, staff are drafting the final rulemaking documents for one regulation, 2 regulations undergoing pre-notice review, and staff are preparing regulation documents for the ADDS self-assessment rulemaking package and revising the rulemaking package for the board's outsourcing facility proposals. Members, do you have any questions or comments on the regulations? Great. As we begin public comment, I think, moderator, we're ready via WebEx. This is just for the regulations portion.
Thank you. If anyone would like to make a comment, you may look for the hand icon and click that to raise your hand. And on a mobile device, you may look behind the 3-dot other options for that hand icon. And our call-in users can press *3 to raise their hands. Are there any comments at this time? I do not see any requests for comment. Shall I close the public comment feature?
Yes, please. Thank you.
Thank you. You're welcome.
Agenda item 6, discussion and consideration of committee's strategic objective. As an Indicated in the meeting materials, the Legislation and Regulation Committee has 6 strategic objectives. The meeting materials include objectives to the respective objectives over the past year. These updates highlight the work of the board in our policymaking efforts to protect California consumers. I believe the objectives remain appropriate and do not believe any changes are appropriate at this time. Members, I welcome your thoughts or comments on the strategic objectives. Perfect. Seeing none, moderator, we're ready for public comment via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment on any of the objectives, you may look for the hand icon and click that to raise your hand. And our call-in users can press *3 to raise their hands. Are there any comments on the strategic objectives? I do not see any requests for comment. Shall I close the public comment feature?
Yes, please. Thank you.
You're welcome.
And then agenda item 6, future committee meeting dates. We have April 16th, 2026 as a proposed date, also June 11th, 2026. Members, if we have no comments, I'd like to thank everyone for your time. And please watch the website for updates on this meeting. I look forward to seeing everyone later this month. Thank you. Bye, everyone.